Premature ovarian insufficiency and infertility. Premature ovarian insufficiency refers to the absence of ovarian follicles before the age of 38. Without ovarian follicles, reproductive cells cannot be generated. Mature eggs will not form and ovulation will not occur, resulting in infertility and absence of menstruation. There are two types of premature ovarian insufficiency: primary and secondary amenorrhea. Characteristics include high follicle-stimulating hormone and luteinizing hormone levels, but low estrogen, progesterone, and testosterone levels. It is also known as hypergonadotropic hypogonadism. Regarding treatment, as the cause is often unclear, there is no specific effective method. Ovarian transplantation involves implanting a healthy person's ovaries after matching into the affected ovaries. Once mature, the ovaries can ovulate and support fertility. However, matching is difficult to find, often relying on the donation of ovarian tissue from mothers or sisters, with a relatively high success rate. Another form of treatment is hormone replacement therapy to promote further development of the uterus and expand the uterine cavity. In vitro fertilization can also be used to achieve pregnancy. In conclusion, premature ovarian insufficiency is a severe gynecological disease and the most challenging type of infertility to treat. There are only two methods: ovarian tissue transplantation or in vitro fertilization. Even if a child is successfully born through these methods, it does not guarantee complete recovery of the ovaries, as the transplanted ovaries may still experience early insufficiency. These methods only address the issue of fertility. Post-surgery, continued hormone replacement therapy is necessary. Hormone replacement therapy is not indiscriminate use of hormones, and the dosage and types of hormones used vary based on the individual's 6 hormonal levels and proportions to meet physiological needs. It is a therapy that mimics the natural menstrual cycle and often requires lifelong medication. As long as the medication is taken according to the standards, it is similar to that of a normal person. If not taken, it may lead to early menopause or accelerated aging during the elderly stage, emphasizing the importance of hormone replacement therapy.